Well, once again, good morning, dear students. Now, after learning the side of the clavicle bone and its anatomical position, now this is the time to learn about the bony features of bone. Bony features means what are the structures seen like tubercle, grooves, roughening, okay? These all structures I am going to tell you here into the these bony features of the bone. And for that we have divided the bone into two parts, that is the medial 2/3 part, okay, and then the lateral 1/3 part. This is the lateral one. So first we will learn about the bony feature on the medial 2/3 part. Now let's come to the medial end, and if you see the medial end of the clavicle, which is articular in nature, you can see this articular surface of the medial end, and this form a saddle joint with the manibrum sterni, and this joint is called as the sternoclavicular joint. Now this is a saddle variety of joint, and then it is the articular surface is also continuous. If you trace the articular surface from here, it is continuous on its inferior surface also for some extent, and this will give attachment or come in relation to the first costal cartilage, okay? Now after this medial end, which is round and large, somewhat quadrilateral in shape, then we come to the lateral, the medial 2/3 of the shaft, okay? Now this medial 2/3 of the shaft, this is the superior surface which is smooth, and this is the anterior surface which is also smooth, this is the posterior surface, and then this is the inferior surface which is the rough. So how many surfaces are there? Superior, inferior, anterior where convexity is there, and the posterior. Always keep it in anatomical position so you are not confused with the borders and surfaces and sides. Right. Now, there are no borders in medial 2/3, okay, because it is rounded structure, okay. So, there are only the surfaces are present into the bone, okay. If we see the surface here, right, what surface we will see here, this is the superior surface, and this is mostly an smooth surface. If we will go to the inferior surface, then we will see that there is a roughening very close to that of the medial end, okay, and then there is a groove here, what is called as the subclavian groove, okay, or for the subclavius muscle, okay, that muscle which is present just beneath the clavicle, and it will get its insertion into this subclavius groove here, right? So these are the bony features of the medial 2/3. If we go to the bony features of the lateral 2/3, as we know, it is a flattened surface, so it will show an anterior border which is concave forward, and in the anterior border, if you will trace your finger, there is a bump is seen here, and this bump is called as the deltoid tubercle, okay, and then there is a posterior border here. Both anterior border of the lateral 1/3 and the posterior 1/3, they are rough, okay, for the muscular attachment. If you will see the inferior surface, though the superior is smooth, featureless, but when you will see the inferior surface of this lateral 1/3, then you will see that there is a big roughening here which is extending from another structure which is rough, that is called as the tubercle, okay, conoid tubercle, and this roughening is called as the trapezoid line. Let me see if I can show a better tubercle and better structure. Yes, you can see this in this bone, okay, and this bone belongs to the right side. There is a bump here. See this bump? You can see this bump, and this bump is called as the conoid tubercle, and this is the trapezoid line. Let me see another better. Yes, this is a better bone here. Now you can see here, see how prominent is this tubercle, and then here laterally will be the that is trapezoid line or trapezoid, okay, crest. This is the line or the trapezoid crest, and then this is the conoid tubercle. This is the reason why the lateral 1/3 on its inferior surface is very rough, okay, very rough. Then Let's come to the lateral end. If you see the lateral end, okay, then you can see an oval facet here, and this oval facet forms a synovial joint with that of the acromion process of the scapula at the acromioclavicular joint, okay, at the acromioclavicular. So these are the bony features which you have learned. Now we will come to understand what are the muscular attachment onto the clavicle. So many muscles are attached onto the clavicle, and I will show you the first muscle which is attached onto the clavicle. It is near the medial end, okay, near the medial end on its superior surface, and this is the sternocleidomastoid muscle. This is the sterno, that is the clavicular head of the sternocleidomastoid. Now what you can do, if you are having the clavicle, just with me, go on marking this structure which I am telling. If you are not having clavicle, just draw a rough diagram of clavicle from superior and inferior surface, and then try to mark along with me. That way you will learn better and will have the concentration on what I am saying. So this is the origin of the clavicular head of the sternocleidomastoid, which is the muscle of the neck. Then if you go here onto the anterior surface, this is the anterior surface of the, just I am turning it, it is of the medial 2/3. So in half of the clavicle, okay, medial half of the clavicle, this is the site for the origin of another muscle called as the pectoralis major, muscle. I will show you these two muscles, sternocleidomastoid, clavicular head, and this pectoralis major muscle from the atlas, okay. So you can realize in a better way how these muscles are taking origin from this surface, okay. So let us see this muscle here. If you can see, I will just bring it down. Now this is that subclavius muscle, okay. This is the subclavius muscle. If there is a better diagram, yes, it is here. This is another diagram which is showing on the inferior surface this subclavius muscle is going, which I will be showing you later, okay. But this is the site for the attachment of the sternocleidomastoid, and this is the site for the origin of the pectoralis major from anterior border, and this is superior surface. Let us see both these muscle here. You can see this muscle. This is that sternal head of the sternocleidomastoid, which takes origin from the superior surface of the clavicle, and from the anterior surface of the the medial half of the clavicle, anterior surface. These fibers which are taking origin, they are the clavicular head of the pectoralis major muscle. So these two muscles I have just shown you. Let us see now the muscle attachment on the inferior surface, which I have shown you in the previous diagram. There is a subclavian groove, and in this groove there is the insertion. So always mark the insertion on bone with the help of the blue color, and origin of the muscle with the help of the red or the pink color. So this is in subclavian groove. This subclavius muscle is attached, which I have shown. Again I will show you. And its margin of the subclavian groove, they give attachment to the clavipectoral fascia, okay, margin, which I cannot show you because it is a very sharp attachment, right. Then we come to the attachment on the lateral 1/3, okay, and in the anatomical position, this lateral 1/3, okay, which has the concavity forward, it gives attachment to the clavicular head of the deltoid muscle, that muscle of our shoulder region, okay, which is the round bulging on our shoulder, that is the deltoid muscle, and this is attached onto the anterior. That means it is origin also from that deltoid tubercle, which I have shown you while I was teaching you the bony feature. So this is the attachment of the deltoid muscle, right from deltoid tubercle, okay. This is the whole margin. It gives origin to the clavicular head of deltoid. If you see the similar on posterior margin, okay, or posterior border of the lateral 1/3, there is insertion of a muscle, okay, and this insertion on the posterior border is that of the muscle called as trapezius muscle of the back. Okay, so one is origin, another is the insertion. So this completes the muscular attachment, except there may be one or two small muscle, sternohyoid, okay, like muscle, they are there, but I'm just telling you the major muscles which are attached. Coming to this, before that I will show you the attachment of the deltoid muscle, okay, on this. Let us see this muscle, this is the horizontally placed clavicle, and from the lateral 1/3, these fibers which are coming, they are the clavicular head of the deltoid muscle. And onto the posterior surface, I told you that another muscle of the back which is inserted here is called as the trapezius, and that subclavian muscle which I was describing attached on the inferior surface, this is that subclavius muscle which is going on to the inferior surface of the clavicle. Let's come to the ligament attachment. This is important bone for the attachment of ligament, and ligaments are always marked with the help of a green chalk, okay, and in your diagram also use the green color for the attachment of the ligaments. Now on medial end, onto the superior surface, there will be the attachment of the ligament called as interclavicular ligament. Onto the anterior border, this ligament will be called as the anterior sternoclavicular ligament, from sternum to the clavicle, and this is extending between the right and left clavicle, so the interclavicular ligament is here. If we go on to the inferior surface, which had shown a rough area near the medial end, this area, this is a strong ligament, okay, and this strong ligament is called as costoclavicular ligament onto the medial end. And then if we go to the lateral end, okay, on its inferior surface, there was the conite tubercle, okay, here, okay, this is that conite tubercle is here, and this was our trapezoid ridge or trapezoid line. These two ligaments are the part of the same ligament, okay, that is called as the coracoclavicular ligament, which has one part to the conite tubercle and to the trapezoid, okay, ligament. Now these two strong ligaments, they are very important ligaments because they help in the transmission of the load of the upper limb to the axial skeleton, that is, this is carried through the clavicle to that of the sternum, the whole load of the upper limb. Now I will show you this very quickly, the presence of these ligaments into the, I mean to say, I can show you this at the lateral end. See these ligaments onto the lateral end. See this. This is showing beautifully the attachment of the ligament. Now this ligament here, which is seen here, this is called as the coracoclavicular ligaments, okay, and this is the part which is onto the under surface of the clavicle on the trapezoid line. Another part, medial part, was onto the tubercle, okay, the conite tubercle. So these are the two parts of the coracoclavicular ligament which are attached onto the inferior surface of the lateral part of the clavicle. Now if I will show you these medial end ligaments, okay, then these are the interclavicular ligaments. See this here, see this going from one clavicle to another, this is on the medial superior aspect of the medial end, this is interclavicular ligament, and on to the anterior aspect from the manubrium sterni anterior aspect going to the anterior aspect of the clavicle, this is the sternoclavicular ligament, and here you can also see the presence of the ligament called as the costoclavicular on the undersurface, okay, of the medial end, costoclavicular ligament taking origin from the costal cartilage and the medial end of the first rib, okay. This ligament is again a strong ligament which attaches the medial end of the clavicle to that of the first rib, okay, it's costal cartilage. So these are the attachment of the ligament muscle. Let us come to see very quickly the relation of the nerves and vessel. Now anterior surface will have the nerve which is in relation just beneath the skin is the supraclavicular nerve. The medial, intermediate and lateral supraclavicular nerve, they are in relation to the anterior surface. On to the posterior surface of the lateral two-third, which is on in its lateralmost part, there will be a relation of the three cords of brachial plexus, medial, posterior, lateral, which are surrounding to the artery called as the third part of the subclavian artery, which will become continuous and will go to the upper limb as the axillary artery. So these are very important relation of the clavicle, and you don't need to know more than this. This completes the attachments, okay, of muscles and relationship of the clavicle. Thank you very much.